Dr. Tolu, can you hear me?
Okay, I can hear you now.
Oh, wow. Awesome to see you.
Good to see you. Sorry, I'm a few minutes late. I just had to quickly tidy up a couple of things. Okay.
Oh, it's fine. All right. Well, this is the Mental Health Hub or Nigeria Health Radio, your wellness
Okay.
companion. Some people have joined in
Okay.
earlier. I'll just do a little introduction for those just joining in. So this is Nigeria Health Radio, your wellness companion. This is the Mental Hub show, a mental health hub show, and this is the show where we bring seasoned mental health professionals to dissect topical issues as relate to our mental health. And today, of course, we have your favorite medical doctor and influencer. Dr. Tolu is an influencer.
Am I?
So,
Am I? Okay.
interesting. We're talking about bipolar disorder. Very interesting one. I realized. So I think it was early this year, or was it last year? We had a particular celebrity. She came on social media to talk about how she was tired of her marriage, and some of us who were really fans of her marriage were shocked. And then she came back to say, oh, she was diagnosed of bipolar disorder. And that was, I realized that a lot of people didn't know what that was until that time, So it's important that we discuss this. But before I go ahead with Dr. Tolu, let me just tell you a little bit about Dr. Tolu. So Dr. Tolu Binutu is a medical doctor with experience in general medicine, emergency medicine, psychiatry, occupational health, and health insurance. He is also a visual artist. Interesting. He seeks to communicate and entertain others and a touch of the spectacular. He is fascinated by business models and the ability to change businesses forever. His true interest leaves him with little time for much else. When I was reading Dr. Tolu's bio, I had to tell him, Dr. Tolu, it's nice about having you. I mean, it's a lot.
Thank you.
You do visual art. How do
Yeah.
you manage being a
How do
doctor?
I combine it? Okay.
And they're like two words apart.
Yeah.
How do you balance
Yeah.
it?
That's a good question. Can you hear me?
Yes, I can.
Oh,
I can.
okay,
Although you
good,
could speak
good.
a bit
Oh,
louder.
okay. Yeah, so let me get to it. So that's why I said, it leaves me with little time for anything else, because like you said, they are worlds apart and it can be quite challenging. But I think if you enjoy doing two things, you always find a way to create time for both of them. It's a challenge, yes, but then because I've tried dropping medicine for art, it didn't work out. Then I tried dropping for medicine, it didn't work out either. So I was like, you know what? Maybe I just need to find a way to do both of them. So yeah.
Okay. All right then. Let's just go to that. That's awesome. Anyways, I mean, it's amazing to know that a doctor can also have another thing to do, and art. It's just amazing. It's like blending the sciences with art.
Yeah.
That's super amazing. Okay, well, I'll just give so I did a little finding, and I found that a survey was carried out in Ethiopia and Nigeria on the prevalence of bipolar disorder.
Yeah, I can see you, but it froze for a bit.
Yes.
Okay.
It must be. All right, so it was discovered that 0.1% to 1.83, didn't know so much about, had bipolar disorder, and then misdiagnosis rate of bipolar disorder was up to 36.2%. And then from that survey, 8.1 of the males and 5.4 of the females reported a previous suicide attempt. So it means that perhaps there were times that they had extreme mood swings and they wanted to do something really drastic to themselves. So this topic is something that it's so timely, and I'm glad we're having the conversation. So having said that, Dr. Tolu, what is bipolar disorder?
Okay. When you told me this was what we're going to be discussing, I was it piqued my interest because when it comes to mental health, a lot of people think about, they think mental health is maybe all about depression and madness. So it's just these two things. And then even the term madness is not something I like. In fact, it's not a term I've used since I started my training in psychiatry. Because it's used by people who don't understand what's going on, right? So let's go to what we are discussing now. Bipolar disorder is one of those illnesses that when many people see, they just term it madness, right? It's more common than we think, and one way it presents is you find patients who oscillate between two spectrums. Now, when it comes to your mood or how you feel, you can say that in a sense there are two ways it could go, right? It's either you are very sad, or it's either you're sad or you're happy. Those are the two. Now, many times you find yourself somewhere, you don't hit the extreme end of either part of the spectrum. You find yourself, somewhere close to the middle. So say the middle is where you are just calm. You are not happy, you are not sad. Many times, even if you're happy, you just tilt a bit to this side. When you're sad, you tilt a bit to this side. You hardly get to the point where you are very sad or very happy. Right? I'm trying to simplify this as much as possible. But in cases of bipolar, they find themselves moving between the ends of the spectrum. So many times you find someone with bipolar who can be very unhappy, low in mood, to the point where it could affect the way their body works. They are, very sad. They don't want to interact with anyone. They isolate themselves. And then that goes on for some time. And then after a while, they then move to a happy end of the spectrum, what we call the elevated mood phase. But in this, it's not that they are happy, smiling. It's not just that they're happy and smiling with everyone. It's that they are manic.
Okay.
Yeah, so that's one of the things that distinguishes bipolar from maybe every other thing. It's either they are manic or they are hypomanic. Now, what does this mean? When you think about mania, you are thinking in terms of an elevated mood. So you find the person is happier than normal. For instance, some of the common symptoms we see in a manic person is the person may not want to sleep because they want to keep talking and talking and talking. It's almost like they cannot get the words out fast enough, right? They don't want to sleep because their minds are racing at like 1,000 miles per second, and they are getting ideas. In fact, many times it's a lot of people who we termed as being creative. After talking to them and assessing their mental health, we find that they are not just creative, but they are actually hypomanic. That means they are having a situation of hypomania because they are talkative. They suddenly seem more charismatic, right? They're making friends everywhere, spending money, clothes, buying shoes. And one way you can know is if you ask someone who is close to this person, they will tell you that this behavior is not normal for them, right? This person is not, there's something wrong. And then if this isn't treated, I've mentioned hypomania and mania. Mania is like the most serious one. Hypomania is like a diluted version.
Okay.
This will lead me to how we classify bipolar. But before I talk about that, so you then find people who move between this very low phase and very high phase within a matter of weeks or months. So that's what. So many times when you say mood swings, you are thinking in terms of maybe I'm not happy now. Maybe they're supposed to pay my salary today and I'm not happy and I'm just looking morose and I don't want to talk to anybody or Sakpa has hit, right? And then maybe after 3 days when they pay me, I'm now happy and then and then as I'm happy, maybe someone splashes water on me with their car and then I go, you find people who yeah, who move between low, who have mood swings. But when it comes to bipolar, it's not just a mood swing. Bipolar is actually a mental health condition, and it's something that should be treated. Someone with mood swings, you may not find the need to treat it, but when you find someone with extreme mood, then you start to think, okay, perhaps this might be. And many times, here's another thing. Many times, you may not find a trigger. That means you may not be able to say, okay, the person may not be able to say that this is why I'm low, this is why I'm elevated. They are just thinking like a pendulum. And even if they are not happy about it, but they can do very little to control it. Yeah.
Okay. So, Dr. Tolu, you know that there are certain temperaments, like those, if you want to go by temperament, like the sanguines.
Yeah.
That when they are excited, they are so excited. They're everywhere, life of the party. It's like you can't calm them down. And then at one point, when sanguines are quiet. Okay, so I think my temperament, I'm a sanguine, for instance. So I know I can be like that. When I am excited, I am everywhere. I can't stop. I'm a burst of energy. Like I have energy for like 3 people at once at a party or anywhere. But when I am quiet, oh my goodness, I am quiet. So is it possible that people, who perhaps fall into this category of temperament, do they tilt towards, bipolar disorder?
Okay. That's actually a very good question. Let me answer it this way. You are you say you describe your temperament that way, right? But that's fine. There's nothing wrong with it. Many times, this is the way we describe mental health disorders. Everyone has a bit of scoin, right?
Yeah,
everyone. But you do not jump to say this person has a mental health disorder until it starts to affect your daily activities, the way your life operates. People that we say have bipolar, when they are low in mood, do you know, get to the point where it affects their sex drive?
Okay.
Someone who normally likes having sex does not want it anymore. The person does not want to eat. The person either sleeps too much or sleeps too little. Even when the person eats, you can see that it's not normal. Maybe the person is eating to compensate for how they feel, or it's depression.
Okay.
It's not just sadness. It's moving between a depressive state and an elevated or hypomanic state. Now, I've had a patient who, in her hypomanic phase, I had a patient who, in his hypomanic or manic phase, bought about 56 hats.
Wow.
And this particular person, it was the wife who came to us and said, guys, this is not my husband. Because she knows that on a normal day, her husband will not, over the space of a few weeks, buy 56, I think it was 56 hats and 30 jackets. You get something like that. Yeah, there's someone who bought a house and sold the house. In the elevated state. There's someone that I know that I've spent about let me convert it to now. I was going to say like £4,000 in a matter of 1 week. So It's not just joy, right? It's not just life of the party. When it starts, it would seem that way. But you then see that this happiness is not normal. Like I said, the person will not be able to, okay. Let me differentiate between hypomania and mania.
Okay.
Both have to do with an elevated phase, but hypomania is mild, right? Hypomania, the person, what you may see is maybe the person is buying more than usual, like this person, like I said, hats and jackets. But in mania, it could get to the point where the person will need to be hospitalized. Like the person is so, okay, if you look at people that that have been described as being mad to you, what are the common symptoms? You see, I'm sorry that I'm asking you, but I'm trying to get the point. What are the common symptoms of the mad people?
Well, perhaps they are moving everywhere around the house, catching things. You can't keep up with them.
Okay, good. And then,
they're speaking to themselves like they believe that you understand them, but you can't even make sense from what they're saying. It feels like sometimes of course, they don't look normal. Their combinations when it comes to
Yeah,
clothing and all of that. Yes. So it's like they're losing touch with the real world,
exactly.
with
Lose
reality
reality.
and reality. Yes.
Exactly. Now, one of the things that you see in mania is
Mm.
in mania it goes beyond being hyperactive. Sometimes they hallucinate. Now, one of the things when you find someone who looks like they are talking to something on their shoulder or they are answering unseen stimuli, that could be
Mm.
mania, especially because one common thing we see in mania is hallucinations. Sometimes they see things that aren't there. Sometimes they hear voices that aren't actually there. And
Mm.
so many of the things that people see and say relate to Yahweh is actually manifestations of maybe, or sometimes you just find that they are unkempt, but they are just sitting and looking,
Mm.
not interact with anyone. They can just be like that, almost in a catatonic state for weeks or days,
Yeah.
very little
Yes.
movement. Many of these things
Mm.
can be seen in bipolar, but they can be seen in the extreme cases. For instance, if the bipolar is not treated early or
Oh,
treated or not diagnosed, like you said something, you said that in more than 30% of cases, it is a missed diagnosis.
yes. Yes.
And that's what usually sometimes leads to what I mean. Bipolar is so common that it's the sixth leading cause of disability worldwide.
Mm.
Times it does not just start as it does not just go to the extreme low mood or high mood. It starts gradually. Many times when you find someone who has it, they will tell you that this thing has been happening for a while, but it seems to be getting worse. It did not used to last this long. This person did not used to, so right. So many times it's when you miss this diagnosis or you do not catch it on time or do not catch it at all, that's when it leads to this really bad cases that we now term madness in Nigeria and all these other places. So yeah.
Right. Thank you so much, Dr. Tolu. So someone said earlier in the comments that she couldn't see, like she can't see me very well. So can you see me now? I was trying to adjust my sitting position just so that it's corrected. So can you see me now? I'd like you to please confirm. She was like she can barely see my head and she was seeing you more, Dr. Tolu. Uh-uh. All right. So moving up. So please just let me know if perhaps if I need to change my position again. Okay. So what types of bipolar disorder do we have? I know that you've spoken about mania and hypomania, but I think that there are different types of bipolar disorder. So I would like you to please,
Okay.
tell
So
us.
like I said, usually with bipolar there is a shift in mood between the depressive states. That is, you can just say depression or low mood, and then elevated phase, which could be either hypomanic, which I said is like a diluted form of elevation,
Yes.
and then
I
mania,
will.
which
Yes.
the really bad one. So using this to understand things, we can classify bipolar into we can just say maybe five, right? Although
Wow. That.
Yeah, although some of the classifications are not specific, I'll explain. Um,
Okay.
Now, sometimes what we see, because I'm trying not to make this laborious with time intervals but basically there is a mild form of
Mm,
extreme mood swings or
okay.
extreme mood swings in the form of mood disorder called cyclothymia. Now, what that means is the person has the low and yeah, something I forgot to mention. Even though someone is bipolar, there are many times that many of them have a normal phase in between. So it's
Okay.
not just moving from no. Many of them have a phase where they are themselves and they are either regretting that, oh my God, why did I spend so much? That was,
Mm.
or they have the low mood where they are like, oh my God, why have I just been locked up in my room contemplating suicide? And another thing, out of 5 cases of bipolar, one would attempt suicide.
Wow.
Yeah,
Wow.
because
When they're low.
yeah, it could be when they are low. It could be when I've had someone who was in the high phase and she was just talking, but and she was laughing, talking, but she said, you know what? sometimes I just want to kill myself, and then she laughed, and then she continued. You get, so it can, many times they have the suicidal thoughts when they are low, but then it could also happen when they are high, because they know that something is off, but they can't control it. Right? So yeah, so in terms of classification, we have, I was talking about cyclothymia. Cyclothymia is, say, a mild form of bipolar, where there's that oscillation, swinging of the pendulum, but it does not usually go to an extreme low mood or extreme high mood. That's the first thing. In terms of degree, it's not as serious as if a bipolar disorder, but sometimes it's classified as a type of bipolar. Okay. That's what. But two, it usually does not last long in either end. So they can be moving like that. Maybe in a matter of weeks, they've moved here. In a matter of weeks, they've moved here. Then they are in the center. Then they moved here. And, it's faster and less serious.
Some people might even mistake that too. They might think that is just regular mood swings.
Yeah.
Actually think that has been going on with them, and their moods are just really swinging a lot. Okay.
Yeah, so especially in countries where mental health is not really prioritized or advanced, that can just be seen as the person is having mood swing. Meanwhile, it's not. Right, so we now have bipolar 1 and bipolar 2. So we've talked about cyclothymia, right? Then bipolar 1 is the one that has oscillation between depression and mania. Now, with bipolar 1, we find that many times, when the way to define it, I'll just define it. You may not need to keep this in your brain, but many times in bipolar 1, we need to see manic symptoms for at least 7 days.
Okay.
And is either we see it for at least 7 days, or the person is so manic or so elevated or hyperactive that the person requires hospital admission or hospital. By the time we see that, and then in that bipolar 1 as well, we usually have low mood, maybe lasting for about 2 weeks.
Okay.
But basically, bipolar 1 and 2 are the same, are similar, only that in bipolar 2, rather than seeing mania or the elevated phase, we see hypomania, which is, like I said, the milder form. Milder form of the elevated phase. So that's bipolar 1 and 2. Let me run through it again. Cyclothymia is the one where the mood swings are not as severe, and then they do not last as long as bipolar 1. Bipolar 1 is when you see maybe low mood and mania. Mania is elevated phase, the full-blown one that may require hospital care. Bipolar 2 is like a milder form, but more serious than cyclothymia.
Yes.
But in bipolar 2, there is depression, but there is hypomania. The worst you probably say in hypomania is a lot of talking, a lot of spending, a lot of giving out. You'll be doing animal show, you'll be paying. Honestly, when you think about this, my description, some people probably come to mind, right?
Okay.
Yeah,
exactly. Like, oh.
Talking that you're talking so fast that you may even start seeing saliva because they can't get the thoughts out. Then they are working on something, they are getting creative ideas, they are, many times, and many times it will get worse over the years if no treatment, right? So we've looked at that. Then there are two more types, right? There's the one where we call bipolar that is otherwise specified. What that means is when you see a bipolar that does not meet the diagnostic criteria for maybe bipolar 1 or bipolar 2 or cyclothymia, it's just a different kind, but you can see stuff, but you cannot really place it. We have a classification for it. That's
okay.
So we've looked at cyclothymia, bipolar 1,
bipolar 2,
and bipolar
and
special criteria. Then the fifth one is the most serious one of all. Right now, call it rapid cycling bipolar. This one comes like a wind. It comes like a well, like you will know that there's something wrong here. You will know. Nobody will need to, you will know. These are the ones that people even say that four or more episodes, like swinging between. It's extreme. It's like just bear it in mind, because you may not need to know how many episodes, you will not be counting for them, but just know that this rapid cycling is probably the most extreme one.
Wow.
Yeah, so those are the five. That's the 5 forms. Yeah.
Thank you so much, Dr. Tolu. So initially I was thinking that bipolar 1 would be the height of it, and knowing that there is now rapid cycling.
Yeah.
Wow, this is really, it's more serious than I actually thought it was. All right, so what you've mentioned a lot during the course of talking about all of these types of bipolar, but just so that people can hold on to symptoms, like sometimes when you answer specific questions, it just sticks in the head.
Yeah.
So what are the symptoms of bipolar, that when you just see it, you know that okay, I think this person, this my friend, might need to go to the hospital or might need to get this checked. Yes. So what are the symptoms of bipolar?
Okay, so when talking about the symptoms of bipolar, you have to think about it in terms of the low mood phase and the elevated mood phase. That's depression and mania or hypomania. So let's talk about the low mood. Think about the times where you've been very sad. Then those symptoms you had, multiply it. So you are talking about sadness. Most times you may not want to eat. You stop socializing like before. You want to sleep, but one of two things happens. It's either you are in bed but cannot sleep, and you're having really sad, negative thoughts, or you are sleeping but you are coming in and out of sleeping, and is a restless kind of sleep, or you are just sleeping longer than before because you don't have energy for any other thing, but abnormal sleep patterns. You look up, well, someone's sex drive could just hit rock bottom, that what's the point. Then something very significant, the kinds of thoughts that they have negative thoughts of hurting themselves, thoughts of let me just end it, I'm tired of this life, I don't want to live anymore. Sometimes they would even attempt suicide. Sniper, like I get people in my DMs who do some really horrible things to try to kill themselves, and I have to refer them to therapy, because this thing is more serious than a lot of people give it credit. They have problems focusing, they have problems remembering things, problems making decisions. Basically, the things you see in a depressed person, you could see them in bipolar. Then the other end of the spectrum is the elevated phase. Hi.
Oh, I think the network.
Yeah, it froze for a bit. Should I go?
Yes, go ahead, sir. Go on.
Okay. So in the elevated,
I can still make out your words.
Okay. In the elevated mood phase, there's excessive energy. The person has racing thoughts, is talking more than usual. Sometimes they even have this burst of creativity where they're getting ideas. They may decide, okay, I'm going to start a business, or I want to buy a house. And usually if you're maybe the parent or the husband or the wife, you're like, this is not normal for this person. And person does not want to, maybe it's just person gets ideas and person is not tired. That's something to note. Like, it's not like after going without sleep, the person is not tired the next day. The person just keeps going. Almost like steroids. And then the person wants to go out to parties and meet new people, talking to people, might even make a lot of friends, might dash out money in an unusual way. Like, imagine someone who has 1 million in savings and just withdraws 200K and just starts throwing it at the friends, and everybody's like, hey, thinking that okay, life. But meanwhile, the person spent going into debt, making really bad decisions. someone's sex drive could even hit the roof, like always wants to have sex, wants to eat, wants to, or may not even want to eat because they are moving at, you know, in a lot, a lot within a short period of time, the elevated mood phase. So in bipolar, you could see this low and the elevated, depending on which phase you catch them in. Yeah.
Wow. Thank you so much. So that was quite enlightening. I mean, and some of those scenarios you painted, wow, you guys with their life savings, 200,000. Hey, for 1 million. Okay, all right. Just because the network is beginning to really interfere, and I want to ensure that you've answered all our questions before it cuts us off. All right. So, what are the risk factors of bipolar disorder?
Okay, risk factors. Yeah, something I want to say. You can also see bipolar in kids.
Yes,
Yeah,
yes,
you can see.
yes. Yeah, I missed that question. I was going to ask you, like, what are the symptoms of bipolar in children and adolescents?
Yeah, so it's basically the same, but it will just be within the context of the way kids and adolescents act, right? So for adolescents, of course, the sexual aspect, that's when they are just getting into themselves, going from the pubertal to the pubertal stage. I'm saying puberty. So reckless sex is one of the common things we see. Like reckless sex, reckless spending, a lot of the things I've already described, but just think about those things in the way it would affect a teenager or a child. And many, because there are some things that present in a similar manner when it comes to kids or adults. It's best not to just jump to, okay, this must be bipolar. For instance, in children, there's something we call ADHD, attention deficit disorder, where they cannot focus. Their minds are also racing, right? So we see that also. And that may be what's going on. It may not be bipolar.
Okay.
Yeah, so it's best for both kids and adults to look at a couple of things before we diagnose. Look at the presentations, how long it's lasted. It's good to also talk to someone who knows them as well. By the time you ask a couple of questions, rule out a couple of things, you will tend to know, okay, this isn't substance abuse, because sometimes substance abuse disorder presents like bipolar. Sometimes borderline personality disorders to present like bipolar. So ADHD as well. It's that's why you need to see a psychiatrist. It's a psychiatrist who will be able to differentiate some of these things using the different criteria for the different illnesses. Now, for your question, risk factors. It runs in families. We've noticed that bipolar disorder tends to run in families. So one common question we ask people who we suspect is, does anyone else have it? Now, that might be a bit difficult to ask in a country where there's a lot of misdiagnosis and misdiagnosis. So what you can ask is, maybe if the person comes with his or her partner, you can ask the person that, okay, is there anyone in your family who has ever had something similar to this? Then they may tell you that, my dad too, at some point, he spent his entire life savings. He was not playing with his kids anymore. He was always with his friends, always gisting, always wanting to talk. Then he started getting violent. Mania can present with violence. So you may find a description like that. And then something like a description of someone who was really, really careless, sudden carelessness, right? And then you know that, okay, maybe this is what was going on. Many times let's say like in the UK now, they will tell you that, oh, my mom had it. Because here, the mental health system is a bit more
structured.
Yeah, more structured. Yeah, so they will tell you, or it may not be bipolar, it may be a history of another mental health illness. Maybe they can say, my dad was manic. Meanwhile, it may not have been mania. Maybe it could have been that the low phase, nobody saw it. You get, so it runs in families. That's something that is very important to know. Now, in terms of sex, people think that, okay, women have it more, but that's not true. We found out that men have it as much as women, right? I think statistic is It affects, is it 1 in every 50 people?
Mm-hmm.
So yeah, so those are a couple of the risk factors, really.
Okay. All right. Interesting. That was quite insightful, by the way. But well, before I ask these other questions, I just want to know, because I'm sure that there are people who are watching this and perhaps they feel that, oh, this sounds like me or sounds like someone I know. How do we ensure that people are more, are more open to seeking care when it comes to mental health issues in Nigeria? Because you're going through something like that, I'm just ashamed. I don't want anyone to know. You're having suicidal thoughts, but you don't want anyone to know that such a thought went through your mind, or just because you don't want them to think you're mad. I was even still discussing with someone this morning. I was like, "Are you going to join the conversation?" And the person was like, "That conversation is for people with, And I'm like, "What if you find out that something that you've probably been seeing the symptoms, what if you get an answer, during this session, and that was actually what convinced the person to join it." So I want to know, how do we change this narrative such that people are more open to seeking help when it comes to mental health? Because it's really alarming how people just keep quiet even when they go through things like this.
Yeah, that's another brilliant question you've asked. And the thing about mental health is the stigma is what
Mm,
it's just that
mm,
it's to varying degrees. Now, even in developed countries, I don't like using that term developed. Even in countries,
but
but
it's
there's the stigma attached to it. Especially, I think there was a study done that said um, there's especially for the stigma that there's increased stigmatization when it comes to illnesses like schizophrenia,
mm,
uh, drug addiction, right? So yeah, even in that case, in cases of maybe depression, bipolar, there's also a level. The only thing is here they are making bigger attempts to get people to
mm,
know that number
mm,
one, mental health disorders are usually not the fault of the person.
mm,
Number two, the illness is different from the individual. I know I have a consultant that I look up to who says when treating mental health, do not do not treat the do not define the person by the illness. Understand
mm,
someone with an illness. The person is not
mm,
the illness. You understand?
mm.
So when we can understand that okay, this is an illness just like any other thing. I mean, you wouldn't criticize someone for having malaria.
Mm-hmm, true.
And
Because it just feel like it is what it is.
uh,
It's just a.
only the person that has malaria might even be a bigger culprit in the illness. You've been telling the person use insecticide, person not here. Do this. But when the person has it, the person assumes what we call the sick role. You are now a
Mm,
patient. We will treat the illness. No stigma attached whatsoever. But when someone who it might just be in their genetics, and then at a
mm,
particular age there's an activation of the gene, and then the person has a mental health problem, then we now want to make the person, in fact it saddens me when someone has a problem and then you see the person on the road looking unkempt, you are stoning the person, laughing. It says more about you
mm,
than about,
mm, mm,
you understand? So in the end, a lot of these things, sometimes it's just genetic, sometimes, so we need to create more awareness, especially with
mm.
this kind of shows. That's why I don't think you can invite me to talk about mental health and I'll say no. Like I'll make out time because the news needs to be spread. The news needs to be spread that there are illnesses just like any other illnesses. And you should not, it shows a great level of ignorance to just say this person is mad, or this person, because the person is looking unkempt. It is a problem that can be treated. And
Mm.
it's a problem that does not have to define you. I mean, here, how much time do you have? Because I could go on and on. But that's the thing. It's basically about creating awareness. The same way
Okay.
we've sponsored things about breast cancer, about HIV, about it's the
Oh.
same way, the same energy and gusto we should put into talking about and creating awareness about mental health disorders.
Mm. All right. Thank you so much. So what are the complications that could arise from, bipolar disorder? Like when
Uh,
it graduates from bipolar, what could it become?
Yeah. So the thing about it is, if you don't treat it, just think about some of the things I've said. You have something that causes you to spend more than usual. You have something that makes you sad and contemplate suicide. You have something that makes you not eat, makes you not want to interact with families. Just thinking about the symptoms, just think about what happens if we do not put a lid on these things. Let's just follow one trail. Someone who keeps having suicidal thoughts and nothing is done about it, keeps having suicide. I said 1 in 5 of them would attempt suicide.
Yes.
So one of the complications that can happen is suicide. There's someone who, it's affecting the job, low mood, is reclusive, does not want to do anything. You keep going like that, job loss, you lose, poverty comes in. It just branches out into a lot of negative things that can happen if this isn't treated on time. It breaks marriages, because especially the wife does not know this is a problem. The husband is not getting help, or the husband does not know, and then maybe in the manic phase, the husband goes out, sleeps with like 7 different women. You can understand if she does not know it's a problem, it will hit differently from if she knows that it is a problem. So the complications are far-reaching. Yeah.
All right. And so, how can bipolar disorder, be treated?
As with many mental health conditions, we use a model called the Biopsychosocial Method. Now, I think the method was developed in 1977 or so. What it does is it approaches things from a holistic point of view. So, what do I mean? When you hear biopsychosocial, biology, psychology or psychological, social, environmental factors. So let's talk about biology. That's where medication comes in, right? Okay. And there are different kinds of medication, really. Do you want to know the details, or should I just call it medication?
The peripheral info.
Okay, so we give mood stabilizers.
Okay.
But yes, there are drugs that can stabilize. There are drugs that can move you from high, elevated, to somewhere in the middle, or from low, bring you up to somewhere in the middle. There are different drugs we use. We use lithium, we use anticonvulsants, we use antipsychotics. But basically what these things do is to help to stabilize the mood. Okay. So that's what we do with medication. Then with the psychological, that's psychological. We talk about therapy, right? It could be therapy, it could be cognitive behavioral therapy. But basically what therapy is doing is, rather than just pumping the person full with medication, therapy is trying to get the person in the right headspace. Especially when it's family therapy, you're involving the family as well, so that everybody knows, okay, this is an actual problem. Let's not blame Lagbaja for this thing. Let's all come together to see how we can help. Then the social part is like social environmental things, lifestyle change, healthy diets, adjusting your sleep to sleep well. Because many times, bipolar disorder has triggers. For instance, if someone who has a tendency to have it is not sleeping well, or is under a lot of stress, this thing could act as trigger. So stress relieving techniques, sleep well, exercise, that's that. So by the time you combine these things, you see that you've touched on every area of life, causing an improvement across board. So that is the method we use when treating bipolar. There's no cure for it, but it can be managed. With proper...
right out of my mouth. I was going to ask you if it can be cured. Wow.
No cure. Although there's something that sometimes happens. By the time we've treated it well for a while, the person may not have any symptoms for a really long time. We call that remission. We are careful not to put a tag of cured. We just call it remission. That means treatment has been going so good that the person has been living a relatively normal life for a really long time. So but strictly speaking, there is no known cure yet.
Oh, wow. Okay, okay. Well, I mean, if it can be managed, it's still good news.
Yeah,
Of course,
very.
I was hoping you would be cured. But because I mean, that celebrity I mentioned at the beginning of the show when I was saying, I mentioned that someone came out to say, that she has bipolar, where she acted in a certain way and dropped something on social media. She came out to say, oh, she's been diagnosed of having bipolar disorder, but she's doing fine now, and her career seems to be progressing. So I guess, yeah, what you said holds true. It surely can be managed, and they can live normal lives at least for that period until perhaps they need to see a doctor again. And
Yeah,
okay, so Dr. Tolu, we need to go,
yeah.
because we have another show coming up by 10 a.m. But before we do, any last words for people listening, just so they
Yeah.
know and perhaps get motivated to seek help.
I would want to say this. Um, as I am a psychiatrist in training, but I have a psychiatrist that I see. Right. So what I want to say is there is no shame
Mm,
in seeking mental. Like you don't even have to wait till you are overwhelmed or you
mm,
are very sad, or it's affecting your life. Personally, I believe everyone needs to have a psychiatrist. Everyone needs to have someone they can talk to about problems to help them unravel things, have a better understanding of their lives, better stress relieving techniques, better ways to
mm,
sleep, better ways to deal with mental health. Because, like I said, every single person, nobody has mental health. Every single person has something that
mm,
under the right stressful, let me not say right, under a stressful environment can erupt and lead to something that will require treatment.
mm,
Best not to get to that point. It's best to just
mm.
have someone, at the very least, a doctor that you know is skilled in helping with mental health conditions. Have one, in your corner.
Well, okay, don't mind me. Like I said, then I can actually be full of questions. So I know that something happened yesterday in a popular reality show, the Big Brother Nigeria show. Let me just say it.
Yeah.
And so a particular housemate is, I think he's really attracted to another housemate, and a little drama unfolded. And the younger sister of that housemate came out to say, oh, that the organizers of the reality show are toying with his mental health. And I went through the comments and I saw someone say, oh, you guys just blame everything on mental health these days. And, it really bothered me because I'm like, so if we feel this could affect a person's mental health, I think we should have a conversation about it. I think we're getting to that point where people feel that, oh, now you just use mental health as an excuse, to get away from problems or challenges. Did you have anything to say about that? I mean, do you think that people are not using mental? Because someone could say, oh, you spoke to me in a certain way and it affected me. Like, I started getting I started getting scared to the point that fear started tormenting me, and then someone just says they're just using mental health as an excuse. So I don't know. I feel we should also address this as briefly as we can.
Okay. One thing I would like to say is, as with many other things, everybody is at a certain degree of enlightenment and of
Mm-hmm.
fortitude. So
Mm-hmm.
what may hit Mr. A and Mr.
Mm-hmm.
A makes Mr. A stronger. And Mr. A is, like you mentioned something about temperament, the
Yeah.
melancholic, the sanguine, there are different kinds, right? So what may hit Mr. A and make Mr. A feel like, I'm going to bounce back from this, I'm not going to let this bring me down. For Mr. B, it may have a different thing because already there are predispositions that are unique to that person based on heredity and genetics, based on how the person was brought up, based on there are a lot of things that make up a human being. So
Right.
if one person is saying this is affecting my mental health, the least we can do and the least that should be done is to investigate.
Mm.
Assume that the person is not lying. I mean,
Mm.
what could happen what's the worst that will happen if you investigate and find out that okay, maybe it is not actually mental, or maybe the person is just, it's best to just assume that the person
Mm.
saying something that is true. If someone comes to you and says, let's say I go just kill myself, don't just, the person may say it casually, but don't just
Mm.
assume. Treat it as something serious. It's like if someone comes and says, maybe sees a 5-year-old child and says, "Oh my, bless me, I just rape this child." You will not laugh and just dismiss it. You will
That's
look
not
that,
funny.
are you all right? Like, you want to find. So in the same way, if someone just says something, or if the person appears to be affected, mental when it comes to mental health, just your default response should be, "This is true," until proven otherwise. Because everybody is different. You find people who just say something, you dismiss it, and then the next day they've killed themselves. Because they were not. So that's just what I'll say. We are all at different ends of the spectrum when it comes to mental health fortitude. And what we should do is to help each other to optimize mental health.
All right, thank you so much, Dr. Tolu, for all that. I mean, I didn't even, I'm sure that you didn't know I was going to take your time for this long.
So it's fine.
Okay, well, in case you just, it was an awesome conversation. I learned so much. You said yesterday that this should be fun. I agree, it was fun. So in case you're coming in, you're just joining us. This is the Mental Health Hub on Nigeria Health Radio, your wellness companion. And I have been speaking with Dr. Tolu. My name is Tolu Tokwe, and I've been speaking with Dr. Tolu Binutu. Dr. Tolu is a medical doctor, and he has a wealth of experience in general medicine, emergency medicine, psychiatry, occupational health, and health insurance. And as you can see, he finished that topic. In fact, I'm sure that the disorder self will be looking like, you just exposed me like this. Yeah, he's an influencer. I keep saying, I mean, you should follow him. Like every time I go to his page, I learn something new. So you should follow Dr. Tolu. All right, thank you so much, Dr. Tolu. We look forward to having you on Nigeria Health Radio another time.
All right, thank you. All right, take care.
Have a good day. Bye. Because we cannot lose this video.